All right. So, hi, I'm Darla Clayton. I work for the Alliance in the area of community relations. I have the CCM2 gene, so I have multiple cavernomas in my brain, and my kids are also both affected with cavernous malformations. So, my son has been the most affected in our family. He's had 3 surgeries, and he's had physical disability since he was a baby. So we've been dealing with this for, he's just about to turn 20. So almost, it'll be 19 years now that we've been going through this with him. So I'm really excited to welcome this panel of fantastic cavernous malformation survivors to chat with us tonight. Before we get going too much, I wanted to just mention that we're going to do some Q&A stuff as we go on. If you have questions, feel free to pose them in the Q&A, which you should be able to find at the bottom of your screen. If you put them in the chat, there's a good chance we will miss them. So if you put them in the Q&A, I'll make sure that we do our best to get to the questions. And there is a chat function, so if you want to talk amongst yourselves, that's fine too. We are having a support group meeting right after this meeting, so if folks want to stay or to join our support group, I'll make sure the link gets dropped into the chat for support group. All right, so without further ado, I'm going to go ahead and introduce our panel members one by one, and they're going to give you a little bit of their story and talk about how they've been coping with their diagnosis. So we're going to go ahead and start with Deb Brandon. Hey, Deb.
Hi. Well, thanks for asking me to do this. As you know, and I open my mouth and it all comes out. I also wrote a book about it, which helped me go birth. So I was 46 when I was first diagnosed, and I just had these fleeting symptoms. I thought it was to do with stress, didn't think much about it. But at my next doctor's appointment, my annual checkup, I mentioned it, just to be safe. And that's when I was diagnosed. And there was one neurosurgeon. I asked him, could this happen again? And he goes, chances are not. Chances are that's the end of it. Well, a year later, I proved him wrong. So I had some acute bleeds. Two of mine that I know of have bled. Actually, I know that more have bled, but more or less asymptomatic. And one in the brainstem and a big one in my right parietal lobe. And basically my life went to pot. And I'm from Pittsburgh. Well, this happened in Pittsburgh. I now live in Colorado. And I'm not originally from Pittsburgh. The accent is legit. I was born in England. So what happened was, I was going back and forth. I was going into the ER a lot every time there was a new symptom, every time one symptom became really bad, that kind of thing. And I was told that they'll do something when if I have another acute bleed. Now, at the time, I was at the yes doctor, no doctor kind of frame of mind. I wasn't, I was confused. I wasn't thinking straight. And I accepted that. It was yes doctor, no doctor. But then one of my ER visits went in for seizures at that point. One doctor basically told me that I was just seeking attention, that I was an attention seeker, that I didn't have I didn't have any symptoms. She explained to me that cavernous angiomas are harmless and that I needed to see a therapist. Until that point, I was kind of in denial in some way, but that kind of threw me out of denial. And that's when I started doing my homework. And that's when I found, well, at the time, certainly it was the only known treatment to prevent future bleeds was to have the bleeders surgically removed. And I went into that. I ended up having, the two that bled were removed, and then about 10 days later, I ended up with an emergency surgery. I had a cerebral spinal fluid leak from the site of my brainstem surgery. After the first two, I went to inpatient rehab. I was there for a week. I was supposed to be released the following day, and that's when I had a grand mal seizure, or whatever you want to call it, and that's when they found the CSF leak. In the rehab center, they assumed I was coming back. I didn't, because I didn't have when with the first two surgeries, my mother was there and she was my advocate. I didn't have an advocate with the third surgery. My then husband was coming back and forth. I had the surgery in Arizona, and I was coming in from Pittsburgh, and I came in from Pittsburgh. So I really didn't have anyone to advocate for me. And the third surgery, that was the one, I didn't have any time to prepare myself for it. That was the one that broke me. And I had no support. At the time, I was really resentful towards my husband because I saw what he didn't do. I didn't see what he did. I was in a me type situation. And only now I mentioned to Darla that I'm writing a book with a woman who's a caregiver to a brain injury survivor. And through her stories, it helped me understand my ex-husband more. I finally got rid of that resentment that was so toxic for me. He just wasn't, he just had trouble dealing with the enormity of it all. I mean, he had to take over all my chores. We had two teenagers at the time. He took over. There was very little I could do, and it was tough. It was tough for him, which at the time, so self-absorbed, I didn't see it. Plus, I was going through a bratty teenage stage, and it was like he's not doing what he should. I'm the center of the world, this kind of thing. I didn't have any outpatient rehab coming back home. I only knew about a neuropsychologist from the inpatient rehab I was in after the first two surgeries, and I knew to work to get one. I was the one who set up all the medical appointments. My ex didn't do any of that stuff. He did take me to the ER each time, but the more mundane type problems, he didn't. I had to deal with it all. So I didn't have anything like speech therapy, physical therapy after the third surgery, and I think it probably prolonged my recovery, but on the other hand, I guess it brought out my stubbornness, which was very, very helpful. And it's a struggle trying to figure out your identity. You lose your identity. I was a mathematician. I taught at Carnegie Mellon University. I didn't know if I'd be able to go back to that. I couldn't be the mother I wanted to be. My relationship with my kids, with my son was always good. With my daughter, it got really bad at one point, and I know it was because I just didn't have the wherewithal to be the mother she needed. Now everything's okay. Life is good, and we have a very close relationship. I did end up going back to teaching. I retired early at the age of 60 because I just couldn't do it anymore. It was just too much. But life is good.
Thanks, Deb. I appreciate all of that. Your story is I love what I love about your story is that you really had to kind of start from scratch on a lot of things. And I remember when we talked in the past, you were talking about having to learn to read again. You know, and you're a college professor and now you have to learn to read again. And you did. You know, you figured out how to get through all of that. I think it's pretty inspiring. So thank you for
Yeah.
sharing with us.
I also had to relearn the multiplication tables.
Right.
And I'm a mathematician, right?
Yeah, that's a lot. Sure a lot.
Mhm.
Um, Ty,
Hello, hello. I'm Ty. I had in 2019, was June 5th specifically, I was rushed to the hospital after my engagement photo shoot because I was having issues with balance and coordination and in vision. So my vision was blurry. And I was rushed to the hospital where I was diagnosed with I had a hemorrhagic brainstem stroke, and I was diagnosed with cabinet with CCM CCM2, and it's for the familial type because my brother, it runs on the maternal side of my family. My brother was diagnosed as well at the age of 4. I was diagnosed at the age of 29, and so I spent a week in the hospital and 3 weeks in inpatient rehab, relearning how to walk, talk, see, all of your basic functions. And I was diagnosed with a rare disease called Wallenberg syndrome, which impacts your balance walking. I have a lack of temperature sensation on my left side still. A weird thing is uncontrollable hiccups at times. So I'll get a hiccup and it'll just randomly go on for hours. And I'll get a weird taste in my mouth from time to time. And so with it being in the brainstem, the left side of my body was impacted and the right side of my face had developed Bell's palsy. Um, I'm currently still in outpatient therapy. I still do OT just for the fine motor. Doctors said that because I was a college athlete, that that PT, my brain my athletic brain kind of kicked back in, and I regained a lot of the functions or to be able to walk, run. I was able to jog. A month later, I walked down the aisle. 3 months later, for my wedding, under my own power. So the doctors kind of attributed that to my athletic brain, as they said. But I still had a lot of issues with fine motor and cognitive issues. So I did outpatient OT and I'm still in it now. I took a cognitive test to help with my processing speeds, and I had a lot of trouble writing. So what I did was I went to Target and Amazon and bought those handwriting books that you would have in kindergarten and first grade when they taught you how to write. And I would trace the letters until I was able to regain my writing form. And mentally, what I did was I saw a therapist because I had a lot of trouble mentally. Physically, my recovery, I would say, was as smooth as it could be, but mentally was kind of tough because a lot of the changes within my body, just not being able to feel certain temperatures or not be able to run up and down the court with my teammates and things like that, kind of bothered me. So I did um, talk therapy with a psychologist, and just a lot of things at home. What I did to cope, make sure I try to get outside in the sun to help myself, and do some kind of exercise since I was capable. And those are some of the things that worked for me. Currently, I still have some tightness in my left side. I seen in the Q&A that somebody asked as far as left heaviness on one side, and I still experience heaviness on my left side. Even with my breathing, sometimes I feel like my left side is constricting. Um, and I know I will get into it in the Q&A, but there are things that I do to try and help kick in the sensation on my left side. And I'm just still a life a lifelong learner. I still go to therapy. And what I try to do is I had a lot of difficulty with the doctors, like Deb said, with, oh, we don't see anything wrong because I present physically well. And I kind of had to research Wallenberg syndrome myself and take it to my doctor. So then they were able to see what things I was working with. And so I would say just do your due diligence and make sure that that's what I do. I just try to learn as I feel something. I try to research it myself so then I can take it to the doctor and I'm informed. So that's pretty much my story there.
Thank you, Ty. And did you talk about your book?
Oh no, I didn't talk about my book. So I did I did write a book about my experience. It's called Becoming the Light. It's available on Amazon where I just go through and give my full raw take on my journey of recovery from the day that it happened until right after my wedding. So that's available on Amazon and I can talk about it later on. But it is finished. I see somebody there in the chat. The book is finished and it's available on Amazon.
And that was part of your coping too, right? Like writing it all down.
Yes, writing it down because I had to get it out of my mind. Because I did suffer for a while from depression and anxiety. I had social anxiety from just the changes and being out and about, but the depression really hit me hard. And writing the book was a form of therapy for me. It was therapeutic to get my thoughts out of my head and onto paper. And it turned out to, I guess, be something very good and beneficial.
Awesome. Thanks, Ty.
You're welcome.
Prem.
Hi everyone, it's Prem and I'm from Canada. A little bit about my story is that about 25 years ago is when I guess I found out I had cavernous malformation. I really just had this slight dizziness that I kept having. And at that time, there was a lot of that kind of dialogue of, oh, yeah, so we're not really sure about these things and we think they could be okay. For a while, there was a little bit of a thought it was MS. And then I guess maybe about 2 years later, 2 to 3 years later, I actually had my first hemorrhagic stroke. At the time, the small hospital, small community I was in, they thought I had West Nile virus. That happened to be the happening, topic of the day. They're like, oh, it must be West Nile. Thankfully, I had just had an MRI the day before in another city. So, that was, the intervention was quite minor at the time because the symptoms associated with it were not severe. And they started to resolve after a few days, weeks, but actually at the time I was an honors student in psychology. And I also worked as a psychometrist at the time. I was, a single mom and I was a president of a board of directors, was very busy. And I knew I was still having many issues, so I was fortunate enough to have a neuropsych done and had some relief at school and things because I was not able to perform to the degree that I was used to. And a lot of that took about a year to 18 months to really start to see some resolution from. After that, I just was determined, well, actually, I was kind of told by my neurologist at the time, we don't really think you'll ever work again. And I was like, okay, I'm not really prepared to accept that. That was me, how I was kind of managing the situation is, I wasn't really good at taking that information. So I was just determined that I was going to find every resource available, seek out every specialist in the disease that I could. And I was really lucky to find it. A doctor in Canada that had been around for many years, Dr. Wallace was his name. And I just emailed him and he emailed me right back and he said, come to Toronto, I want to see you. And he was somebody who gave me a lot of hope and was like, yeah, you're going to be okay because we're going to get through this, and gave me a little bit of information that was really important at the time because it was a little hard to get relevant information at the time. So I just kind of decided, sure, I've got someone on my side now. I'm going to forget about this. At the time I was told I had 3 cavernous malformations. I'm going to forget about this. And I actually went into, I finished school. I went into a very high stress career in federal law enforcement. And I got even busier and just stopped my monitoring MRIs and just kind of went for it kind of thing. I was like, I'm fine. Even though I had lingering problems still, especially visually at the time, I just learned to manage it best I could. I, was able to carry a firearm. I was a sharpshooter. I was like, yeah, no, this is no problem anymore. Fast forward a few years from that. So about 6 years ago, I had an emergency situation and I had a hemorrhage in the right temporal lobe. I was kind of in denial in the hospital about it. And it was a very serious situation. I had brain surgery at that time. And I reluctantly had to make some adjustments to many areas of my life, particularly my work life. At that time, I traveled all the time. I worked probably 80, 90 hours a week in my profession. And it was a very hard adjustment for me to adapt to the changes in my life. And other critical things that, we all experience that come up in life on top of that seemed to happen at the time. My mother went missing, actually. Yeah, and while I was recovering, so probably in the first 4 to 6 months, she went missing. And I never saw her again until I found out she was deceased. And that happened in that time period. So there's a lot of difficult things I faced, I would say, which was not as many, thankfully, physical challenges. I was not inpatient rehab once I was released from the hospital. I went into an outpatient rehab situation. But I really had a hard time in defining who I was, because I was really successful, like senior leader in an organization that I was very successful at. And I was facing a lot of discrimination at the time because of my, disability status and the things that I was trying to adjust to. And I was really, really pushing myself a lot because that's how I always got things done in my life. And my body and brain were like, that's not going to happen like that anymore. So it was a really big challenge for me. And I would say it was a life-turning moment when I realized I needed to find answers within myself on how I was going to be able to cope with this and still have a really healthy life as best I could. I had a lot of problems with sleep. I had a lot of problems with reading, scrolling, any kind of movement around my eyes. And so I had a really amazing hospital in the city I live that is all outpatient. So it was a very comprehensive approach with the use of physical therapy, which I didn't really need either, but the occupational therapy was amazing. There was a very specific tool that was used, it's called Karen, which is from a different country, but it is a great tool to use to help with the type of problems I was having, which was this eye coordination, extreme nausea and dizziness every time I turned my head. And that was a really, really great help. At the time, like I was scoring really high marks and they're like, well, we would think you might not really need this. And that's when I really kind of learned through the excellent psychologist I was seeing too at the time, who specialized at that hospital with people who have critical medical diagnoses and recovery, that my situation is me, and I'm so thankful for the abilities that I have and what I've learned and especially what I've learned about myself, but my challenges are mine. And I don't need to feel bad or guilty about them or feel like alone in them. I just need to understand that this is my life and do everything I can to love and care for myself in those moments. So kind of went through, going through a lot of recovery, which, if they come in the questions, I'll add more in. I actually started 2 businesses while I was recovering. One of them was related to holistic health, because many of those modalities actually helped me a great deal in learning how to manage my disease. That's when I found out I had CCM1, that I have hundreds of CCMs. And then in July 2020 is when I had another hemorrhagic stroke in the brainstem. That one is inoperable. When I was in the hospital, I learned from the many doctors that I present with minimal symptoms with sometimes a critical medical situation. And so this is something I really had to understand, is that I have to take things seriously when they happen and not brush them off, which I used to tend to do. And I remember how terrifying it was for me knowing I had the brainstem one that will not be able to be operated on, and feeling like, I know the risk with brainstem CCMs, and how do I reduce my risk? And, I had been focusing a lot on all the external help that I could get. And that's when I realized that I need to do everything I feel I can do to reduce my risk by either gathering information, changing lifestyle, doing everything possible. And also understanding that, things that I feel and see may not be what others do. So since that time, I have been, again, accessing, even recently, currently, through an organization here in my city that has another comprehensive approach on an outpatient basis. Amazing help with an OT, with memory retrieval, attention, and that has been really outstanding, and all kinds of different things actually to assist me in many ways. So that's a little bit about me. Also, I'm also the Western Canada coordinator for Angioma Alliance Canada too, which has been one wonderful thing to help advocate for others and be there for people who need a listening ear and some support. That's me. Thank you, guys. So glad to be here with you.
Thank you, Prem. And thank you so much for all you're doing for the Canadian Alliance. It really is fantastic and appreciated.
Thank you.
Hey, David.
Hi, everyone. My name's David. I'm from Raleigh, North Carolina. Excuse me. August 21st. No, I don't remember the date anymore. August 25th, 2021. I work from home part of the time doing IT support, and I was typing an email and had like a weird vision change, like my world shifted slightly, and I had like a weird feeling like in my head. And I was like, that was weird. And then I continued to go, and then it happened again, and I was like, something's wrong. And I kind of felt like my brain was short circuiting. So I called 911 and told them I was having a stroke. I was pretty sure. And the local fire department down the street showed up at the house and sat with me for a little while. And I was not too bad at that time. I remember just like hanging out with them, like talking and just saying that, I don't know, I just feel weird. And they got me in the ambulance. They wouldn't let me walk up the hill. They had to push me in like a little cart thing and got me to the hospital, and I kind of started progressing and had all of the classic stroke symptoms, slurred speech, right-sided weakness, memory. I don't really have any memory of the hospital at all. It was just like kind of like bits and pieces of my time there. Was diagnosed after getting a few MRIs with a brainstem, a midbrain sporadic cavernoma, since it just had the one. And at the time, they explained that that what we would do is kind of let the blood reabsorb, and then they scheduled me for brain surgery 2 months after. So the plan was go home, rest a bit, and then you'll come back 2 months, do the surgery. And I, at this point, had no idea what a cavernoma was or any of that. And it was just like, okay, get it out. I thought I needed to get it out. And then, so that 2 months, I was released from the hospital and kind of fell through the cracks, I think, because of COVID. I was supposed to get like occupational therapy and physical therapy and stuff, but I think they wanted to get me out of the hospital because of COVID. And so I didn't end up getting to that. There was a physical therapist that like called me at home and was like, I can't believe I didn't know they were going to release you, like all that stuff. But most of my symptoms kind of resolved pretty quickly, which was amazing. Like the right-sided weakness didn't last very long, and I started talking again after a few hours, I think, to the paramedics, although I can't remember it. But went home, and I was just like really disoriented, I think, because my vision was so bad. And like my wife said, when she brought me home, I like started walking down the hallway, and I was like a ping pong ball, like going down the hallway. And I was like, I just have to get used to it. This is my life now. which is my typical attitude that I have with things, like try to stay positive. But I would say the hardest, I slept a lot, like for right after that. I don't remember probably the first few weeks. I think I pretty much slept 20 hours a day and just tried to give myself as much sleep and healing time as possible. And the hardest thing for me was the anxiety. I knew that it could happen again, and I was told at the time like a 3% chance of a rebleed, but I read medical articles all the time, and I know brainstem can be higher, and so I basically thought I was having a stroke every second of the day, and I came to realize that I did have some sort of like head nerve feeling or something that was caused by the stroke that I think was like my nerves are overexcited or whatever, and that's what made me think that I was having a stroke again, because it was such a similar feeling to what I had before. um, so I went to therapy, did cognitive behavioral therapy, and the one thing that really changed things for me was like realizing that I was robbing my current day by worrying about something that might happen in the future. So it just kind of took me to realize that I was doing that, and that I need to be focusing on the 97 or 70% that it might never happen again. Um, I also saw my primary doctor and realized that I was diagnosed with PTSD, medical PTSD, and got on some meds with her help. And between the therapy and the meds, really helped. And yeah, I feel today like I can live with this even if I do have another bleed again, because I've met so many amazing people through the Alliance that deal with this and live perfectly awesome lives and have like 5 jobs like Prem does.
So true. So true, David. Well, I love whenever I hear David's story, I'm always like, he was sitting at the desk writing an email. And that always just strikes me as like we
Sick.
worry about, oh, I should I go out for a jog or whatever. And you should absolutely do whatever your doctor says in that regard. So I'm not saying you should go jogging, but David was sitting at his desk writing an email, and that always just strikes me as like that's, sometimes
Oh,
that's just
and
how it is.
I would also like to add that I was given no information except that I had a cavernoma. So I started searching the internet frantically, and thank God I found the Alliance to Cure. Such amazing people and information, and I studied everything I possibly could, and um, basically tried to do everything I possibly could to like help my brain heal by like eating a brain healthy diet and eliminating emulsifiers. And I couldn't even walk down the street or go to the grocery store at first, and I just took little baby steps. I started walking on the treadmill, hanging on for dear life on the side for 2 minutes. And like every week I added 10 seconds and just kept doing it. It helped me feel better, thinking that I could do something. I wasn't just helpless.
Thanks, David.
Mhm.
Hi, Erica.
Hi. So my story started kind of back when, 2000 into 2005. It was just like a December 27, and I had the day before I went for a jog or a run. I was training for triathlons back then. I was an athlete. I was 24 years old, and I just woke up the next morning, and I just had just like the worst backache that I've ever had. And I went to work. Next day, I still had this backache. I went and saw one of my massage friends because I'd gone through massage therapy school. She worked on me, but it didn't feel any better. The next day, third day, I went and saw a chiropractor, see if anything they thought of. And the fourth day, I woke up and I just had a tingling from the waist down. So obviously something else is going on. So went to the ER and we're there for probably most of the day. And just kind of like throughout that day, I started just like walking a little slower. Like if I was sitting and had to get up, it was just a little bit harder. So I just remember like walking around, sort of just keeping like my hand against the wall. Um, Into that day, well, they did x-ray and a couple things and just thinking maybe if it was a pinched nerve or something. But they sent me home to get muscle spasm pills and pain pills. And I was just like, never had like muscle spasms, but this is not it. And so when my dad and I went to the pharmacy to get the medications, I had to like hold on to the shopping cart to help support my weight. And by then, my left side, I just like it's kind of like how a pirate with a peg leg kind of has to walk. So it was just like my left side just started um, going first. And by the end of that night, I was just holding on, like had to be very intentional with each step. And I remember I had to like crawl back from the bathroom the next day. Like when I went to get out of bed, I just crumbled to the floor, just couldn't support my weight at all. And made it down the hallway and down the stairs, just scooting on my tush. And I was able to like pull myself up and take about 3 more steps, but that was it. So December 31st, 2005 was my last day of unsupported walking. And we went back to the ER. My parents were getting information from other doctors and were like, you should, get transferred to a bigger hospital. So at midnight, I asked the paramedics if they would do the sirens for me. So it was kind of like when they say new year, new you. It was very literal for me. And so I was up at UC Davis Medical Center for 24 days, and they ended up misdiagnosing me there. But so it wasn't until I was back home and then sent to UC San Francisco to get more scans. And so they came back with cavernous hemangioma and misdiagnosed with transverse myelitis. So I went through, I was doing about 4 to 5 days a week with physical therapy. I had a really good physical therapist, but we heard about a place down in Carlsbad, which is where we live now, for special spinal cord therapy. And we went there for about 3 times that first year, a week, in 3 days, 3 days. And my body just really responded a lot better to their therapy. Enough so that we decided to move down here to Carlsbad. So it's been over 17 years since my spine, and I've had scans every few years. We didn't know much back then. I mean, we fell through the cracks with the system, and so just for me, it was like when I was in the hospital, being such an athlete as I was also a PE teacher. I just graduated college with that, and not knowing if I was ever going to do any sports again. I didn't know any sports at all. I didn't really know anything about sports for people in wheelchairs, and so I do use like a wheelchair now to get around. But I have since I work out at a place, Adapt in Carlsbad, where now through them I also teach adaptive workout class. So we have it to where I have a standing example, which right now happens to be my father that loves getting picked on through that. But I teach so that anyone in a chair can do a workout, and anyone that wants to follow along. We have a lot of MS patients, but I've been able to do a lot of sports, over 30 sports since the chair. And in 2010, I became the first female to summit Mount Kilimanjaro using a wheelchair, so paraplegic. And then 2012, paratriathlon national champion, went to world championships, a few different years with that. National champion in kayaking, and I was one spot away from going to the last Paralympics with that. So I just try and not really think about something recurring. When I was in the hospital the first time, doing scans and everything, they were like, "Well, you've had a leak in your head as well," and so I remember back when I was a junior in college, and I just got some bad headaches, and they thought that they were just migraines back then. So could this all have been prevented? I don't know. But my family, so we have CCM1. We didn't know anything about that until I think almost 3 years ago. For my workout classes, I would hashtag cavernous hemangioma. And so I was just like, I wonder if anyone else is using that also. So through that, I found our lovely Alliance Secure. And so we've since then got my mom genetically tested. So we know we have CCM1. Both my brothers, they have been affected. My uncle, so we know it's on my mom's side. And but I just I just got to keep moving. That definitely helps. And then I just decided just try and not think about it, but especially during the special spinal cord therapy, really has helped me. And then just staying active and meeting other people in chairs and doing other sports and whatnot. Just being with the community. So yeah.
Love it. Thank you, Erica.
I have a saying that I like to use: keep calm, it's just your brain bleeding.
Thank you, Erica, for sharing. You are amazing. I love that you found all these sports that you can do. I think finding things that you can still do is so important. And you found like incredible, cool stuff. Like that's awesome.
Yeah, that's awesome.
So we have about 15 minutes left. We can go over a little bit, but not too long because we have support groups. So I'm going to start with the Q&A, and we had some questions come in beforehand. So I'm going to start with those, and then we'll hit the ones that we got during our meeting tonight. All right, let's find those again. So one of the questions was asking if anyone has ongoing aura headache. Someone was going to speak to that.
Yes, is the answer to that. Until last summer. And finally, the neurologist came up with, I mean, it was horrible. Basically, I had ongoing headaches. And basically it was like three times a week, it would get to the point that I couldn't, I wasn't functional. So I had an ongoing headache. This is while I was teaching, there were times I couldn't teach because of it. And then finally, this past summer, was it this past? Yes, maybe it was before. My neurologist came up with something to use as a preventative. And it took some juggling around with the doses until reached a point where, for the most part, I don't have headaches. I still do sometimes, and I had no idea how debilitating it was until I didn't have them so often. I don't know how I taught. I really don't, because various decisions in my life that I was finally able to do, I didn't realize that I didn't have that ability before because I was constantly having headaches. So there is something out there that may help.
Yeah. Yeah, and we do have a webinar we did a few months back about headaches that I think was pretty thorough. So definitely worth checking out. Thanks, Deb. The next question is, how do you cope with unsteadiness, dizziness, and throwing up after a bleed? And I'm just going to quickly say that for me, I just take Zofran. I take Zofran. It helps me a lot with the dizziness and the nausea that I get. So definitely there is potentially a medication that might help. So worth talking to your doctor about. Anybody else have that dizziness and nausea?
I never get nausea, but some sort
Right.
of dizziness, weird head
Yeah.
feeling for sure.
Yeah. Anything help?
Yeah, I do take a low dose benzo that helps. Like I can't take it all the time, but like on really bad days, it does help. Definitely corresponds with storms. Also,
Yeah. Isn't that the truth? So weird how all that's connected.
it is weird.
Yeah. Um, next question. This is a more sort of like family question. How do you cope with your family, extended family, not understanding or trying to understand what's going on with you? Yeah. Like, anybody have family struggles?
I would say what I'd like try to do. I mean, not just family, extended family. Trying to get them to understand is one. I just try to do the research to understand it myself, so I can articulate it to them, and give them an example from their perspective that they can, like relate to. So, um, I'll talk about like the heaviness like in my chest for instance, because you can't see it. So I'll relate it like, hey, it's like laying under a 10-pound like weight, 5-pound weighted blanket or something. So I try to give examples and educate myself so I can then relay that information. And then what I also did was found a community like this, because it's hard for them to understand, especially if they haven't experienced it. So to have that counterbalance, I know we want our family to understand, but sometimes it's good to find a community of, strangers who then become family to, that can relate and can understand. So that helped me a lot, was finding this community. And then I know the Alliance here, they do a great job at educating you and bringing us and having events together. There's the course that I took to become an expert patient of CCM. So I would say don't just expect it to be your family, because they care about you so much that it's hard for them to see past past what happens sometimes. So it's good to indulge in other communities.
Yeah. Those are all great points, Ty. I think family stuff is complicated, right?
Yeah.
Yeah. Yeah. And I think if you have family that doesn't, isn't interested in understanding what's going on with you, then maybe you just don't spend a lot of time with them, unfortunately.
Right.
Or, extended family members don't, it's just not who you focus your time on, right? That's how I would approach it personally.
That's a
I
great
think
idea.
with a brain injury, it's so hard to you can't explain it to somebody else unless they've gone through the same thing too. So I totally think what like Ty's was talking about is a great thing to do. You know, like that's all you can do is educate people. And
Yep. Invite them to come to CCM 101, send them the information for the patient expert course, you know.
I think it's
Yeah, 'cause
important to remember too that these people see us as before, you know, and sometimes like I know for me, like I had, you know, challenges with that too, and you guys have brought up so many great strategies to help with that. I still do. This will not be this will happen ongoing. You know, I find there's many times where I say to my children, well, I am, like when they go, oh, you forgot that. Like, well, I am the one in the family with the brain injury, you know. I try to make some jokes, some lightness, like, you know, when I make the favorite meal and I forgot it in the oven and it was there 10 hours and I had to throw it out. There was times when I was so hard on myself when I was trying to get people to understand. I was actually working against myself and trying to get others to understand, and actually taking away from my own, you know, precious time of being alive and having the level of disability I currently have, as opposed to a worse one. So I love the strategies, actually, Ty, that you brought up. And one thing I did with my kids, who are my close family, the rest of my family is really not involved in my in supporting us and supporting me in my journey, is I used to be a person who could speak for 3 hours without preparing to hundreds of people in a room. Now, if I have a conversation, I will forget partway through what I've already said. And this has been a very big challenge for me. And sometimes it's challenging enough that it makes it really hard to for me to you know, respond to it in a really wonderful, positive way. So I actually said to my daughter one day, I said, who also is a, you know, successful person, I said, okay, in the middle of saying something, I said, stop. And I brought her to her room and I go, why don't you lie down for the next half an hour? She dozed off. And then I went in and woke her up and I go, immediately finish what you were saying. And she had, you know, she's discombobulated and everything. I go, that's a tiny little example of what it's like for me. But imagine how it would be for me to feel like I'm not capable, like I used to be, on top of all that. And the stress, just give that, just be present with it for a moment. Maybe you can kind of understand what I go through sometimes. I just want to add that part.
Yeah.
Yeah.
Well,
Yeah,
in some ways, I'm lucky or not so lucky that my sister went through the same journey I did. 11 years later, she's 12 years younger than I am. And so finally, I had someone in the family who really understood, and we help each other out with that. But in general, yeah, it's rough. The first time I encountered a brain injury survivor, it was, oh my God, you're my long lost brother, you know. It was, you know.
I think we want people to meet us where we're at when we're in recovery. And sometimes we need to meet them where they're at too. And just be kind of aware of that as well.
Yeah, those are all great points. Next question is, how are folks able to cope with a brainstem lesion that's not operable?
I can take that one. Therapy. And I think for me, it was just really learning as much as I possibly could about like I was saying before, that I was scheduled for brain surgery and I wanted the thing on my head because I'm the biggest hypochondriac, and I was like, how am I ever going to live with this thing in my head? But the more I learned about it, I was like, I don't want to have surgery unless I absolutely have to. So that was one thing that I was appreciative over the Alliance to Cure's information that to help me choose that better. But what was I talking about? Coping with. I did a lot of meditation, and I love sound therapy, like the singing bowls. It's funny. I've actually conditioned myself, like when I'm in stressful situations, by like my wife, like when she would take me to a doctor's appointment or something, would make it comfortable in the car for me, put the singing bowls on, and now just hearing them calms me, like if I'm having a stressful moment. So that was definitely a big thing for me, and the therapy, and just information that I can live with this and it's not going to kill me.
Yeah.
Yeah, for me, it was like David was saying, the information, because with having the familial type, I couldn't. A doctor was trying to have me recommended Gamma Knife, which is totally not what you're supposed to do when you have the familial type. So, if I didn't know that through the alliance, then I probably would have just agreed or consented to surgery. So the information, and then two, it's realizing that for me, it's slowing down and being in the present. Just slowing myself down, because when I slow myself down, I realized that I had lived 29 years before something happened. And then I watched my brother, who had a bleed at 4, and he's now 26 and hasn't had another bleed. So when I look at things, I'm like, hey, there's been 20 years of time where something has not happened. So I try to frame it that way to myself. So I know what's there, but I still try to just stay in a positive space to be able to move forward and understand that I'm still capable of doing things. Though I know I have a lesion at the brainstem, and what that comes with, I still try to focus on, the positive things. For me, the first thing that I'm grateful for is to just wake up every day. So I have what I call is my list of gratitude, and then my wins list, which helps me put things into perspective throughout the day when I kind of my anxiety wants to take over, or I want to get hard on myself. So I look at my wins list and I look at my gratitude list each day. And that helps me cope with knowing that I have this condition and that it's inoperable.
Yeah.
I really love that wings list. That's awesome.
Me too. Yeah.
Yeah.
One other thing
I
I can share too, guys, if you don't mind, is when I had my brainstem hemorrhage, I kind of used an analogy like a plane goes down when like 5 things go wrong. So I took a really good look at like what happened the days before. I tried to analyze it. I came up with some strategies, and just in terms of some lifestyle choices I made, many things that you wonderful individuals have brought up already. I just chose that I will be as healthy as I can be in every other way. I will seek out the best doctors I have the most confidence in. I will, engage in meditation. Reiki is another modality that I use. Journaling, gratitude journals, starting my day being thankful that I'm alive, and choosing that, yes, I'm fearful, but I will do everything possible to make sure that I enjoy each moment of each day. And the days that I'm really stressed out and I will not be hard on myself.
One thing that I mentioned earlier to Darla is that we're the lucky ones. We're the ones who can speak for ourselves and hopefully help everyone in the community, and speak for those who can't speak for themselves. That's one of the reasons I wrote my book. I mean, that was because I felt that if I was capable, I should do it for those who aren't. That was one of the reasons. So it's important to talk about this. It really is.
Yeah, absolutely. I will just add that I compartmentalize, which I'm not going to say is always the most healthy approach, but I just like try to put it in a little box and don't think about the fact that I have this little guy in my brainstem, and I do all of the things I can to be healthy, but there's nothing else I can do. And so thinking about it doesn't help me. It's not serving me. And so I try to just put it away. And then I put a little like sit on the box so that the box doesn't pop open on me, and I just hang out there. So that's how I approach it. I really just try not to let it pop open, that box pop open. All right, we have a few more questions in the Q&A we're gonna try to get to.
Can I answer the one about PTSD?
Oh, thanks, David.
Yeah, yes, I still do have that to some extent. And I had a pizza from a local pizza shop like an hour before my stroke, and I still have not had that pizza.
Wow.
That's a
So
good point.
apparently I have some issues still.
Yeah, I
I
still
also
do
have
as well.
PTSD too, from a previous crime committed against me, and also from the emergency brain surgery. So I can relate to that too.
Yeah, I do as well. for me it's post. So anything, the things that I remember from being in the hospital all have to do with like hygiene. So like anytime I go to like brush my teeth, I'll like sometimes I'll flash back to the bathroom in the hospital and it was pink. So I remember it vividly. And I have like a scar on my shoulder from hitting the soap dispenser because I was in a wheelchair then. So it kind of takes me back. So yeah, I still suffer from PTSD as well.
I think one thing I've learned too is I am very vocal about my experience, because even when I go into any other kind of medical situation, like a cortisone injection to dental surgery, I'm really clear with all of them. Listen, this is what's happened to me. So if I'm talking too much or if I react differently, you'll know how to handle it before it happens. This is how it manifests for me. For instance, certain smells do trigger me somewhat. And actually, when I'm masked, so during COVID, that was a challenge, and I cannot breathe and use my tools, that is worse for me too. So just try to feel comfortable about advocating for yourself. You're very important. And PTSD is something that you know best, maybe what your triggers are, but maybe one will come up that you weren't even thinking about. So at least if everyone's aware, they know what's happening. And I know that it may feel uncomfortable talking about it, but you're worthwhile to do so, and they'll understand.
They're great points. All right, we have a question about fatigue. Has anyone
Oh.
experienced extreme fatigue after a am I
Yes,
yes.
That-
I
I
slept.
think
think
the
that
answer
is
is
that is probably, well, that's my most, I guess, problemsome deficit now. Like I can one day I'll be able to do a bunch, and then maybe another day I'll do a few dishes or a load of laundry and I'm wiped for a week. So I still deal with fatigue. I'm actually tired now, but I've just learned how to manage and deal with it.
the thing is with fatigue, with neurofatigue, is you can't, it's not like neurotypicals can sort of push their way through. You just can't. Your brain just going, sorry, not happening. So yeah, fatigue is huge. And many of us don't sleep well, which is part of the package. So it's a double whammy.
Mhm.
So
Absolutely. And some of the strategies that I use, fatigue is prevalent years later even. And I used to fight against that a lot, but now I just accept that I will learn how to manage it best for me. And it's incredibly individualized. I feel like probably all of you guys feel that way as well. Is I know in the afternoon I need a time to just do nothing. And I'm in loving myself, I will give it to myself. And I've learned to say no. That was one of the biggest things that I could have done in my recovery, was learn to say no. I used to be a person that was never saying no.
yeah.
And I find that, really, really knowing for you what expends your energy the most and how to manage it is what's going to help you the best. So don't, build up a lot of appointments in your day. Always know what time of day maybe you need a rest. Maybe it's a sleep. I'd love it if it was a nap, but even just quiet time, I might meditate during that time. It's just time where my brain doesn't have to be overloaded, kind of thing. Recognize the signs in yourself that make it more difficult for you, and listen to your body and love yourself enough to say, no, thank you. I can't meet you today, but I'd love to meet you next week. And then I think you mentioned it's very dynamic and it's very individualized, and take what you need, please do so. That's the best thing you can do for yourself, because when we're tired, I'm sure all of us can agree on this, our symptoms are more prevalent, they're harder to deal with, and it becomes like a domino effect. So if we don't stop and say, I need to do this for me so I can be better for myself and for everyone around me, and then we're going to regret that a little bit. And we've been given a day to live more and more and more. So let's live them the best we can.
Mhm.
And check out the spoon theory, right? That spoon theory is worth checking out when you're dealing with fatigue and neurofatigue, especially.
But people who are sort of anywhere near type A personality before, learning to pace yourself is that's really tough. And this happened to me in 2007. Is that right? Wow, it's been a while. And there's certain things where I need to listen to myself better, that I just I'm terrible at pacing myself. I'm much better than I was, but
Absolutely. And don't get into important discussions when you're tired.
Ooh,
You know,
good point.
be okay with
point.
saying, hey, I'm not able to do this right now because I'm not at my best self right this moment.
yeah.
I need this right now. And yeah, build your schedule that way and commit to a block off times if you use a scheduler for you, for your rest time or whatever it is you need to make you feel a little bit more energized. And if you have the spoon theory is amazing. If you need help with managing that spoon theory or putting in theory for your personal situation, I would suggest that that's a great thing to work with a therapist or a psychologist on, or even someone close to you that you trust that will help you kind of navigate it a little bit.
Yeah. And send that to your friends and family too. You know, those people that are giving you a hard time about things, send them the spoon theory because it's worth them understanding that.
Exactly.
It's a
Yeah.
tough one for people to understand, who outsiders to the community to understand that whole thing, especially if you yourself have trouble pacing
Right.
yourself.
Yeah.
It
Very
is,
true.
and often in our social lives, that's where it manifests the most, I find. And
Mm-hmm.
so, I mean, I'm not very good at telling people who are not really close to me, well, the reason I can't do this, and the reason I can't do that, because I don't want to be focused on this all the time and all the can'ts. So I find that that is the place that it will show up as having some impact. So other people understanding, hey, like, yeah, I get you can do all this, but for me, I am not able to. And that's just me. I'm still amazing, but that's just me,
I've lost friends because I've had to cancel things at the last minute, but like Darla said, okay, so they're not the friends you need.
It's so true.
Yeah. Well, we have to wrap up because we have support group, which has already started. Thanks to Lindsay for starting it. But Erica, I just was wondering if you could talk a little bit more quickly before we go about like how you found para sports and how that has helped you cope.
We were first, I guess, introduced to, we found someone through the newspaper in our town, and he came over with his hand cycle. That was the first thing, first sport that I got into. And then just through other groups, now it's like if I see, like a flyer on golfing, it's like, okay, I haven't tried that sport. And so I'll just go and try it. And so just like through people, I've been introduced to different sports, and I've competed in probably eight different sports. And you just gotta try and see which one works best for you. My body does not, golfing is harder for like my torso. Competing, it's harder, not having as much core or abs. So you just find what sports, work best for your body, and just to try and keep moving, and definitely, helps you out in the long run.
Yeah, so true. Being active is, being as active as you can makes such a difference.
Yeah, that's why I like doing, teaching the class, and whether it gives someone their one workout a week, we're working on our upper body and what we can still move. And so
Unfortunately, the daily headaches stopped me from exercising for such a long time. And finally, really got good to be exercising. Love it.
Right? Absolutely. Oh, well, on that note, I just want to say how grateful we all are to you guys for coming and sharing your stories tonight and answering questions and just being part of our community. It just means a lot to all of us, and it means a lot to me. And I really am appreciative of you guys for joining us tonight. We do have support groups. You can feel free to hop on right now. It is going to start up, and we can continue more of this conversation over there with anyone who wants to pop on. If you need the link, let me know real quick, and I will go grab it one more time.
I need the link.
All right, I'm on
I'll
it.
go over there.
Thank you, everyone, and thank you to all the panelists. I learned so much from you, and thank you
Yep.
for everybody who's attended tonight.
Thank you.
Thanks.
You guys are awesome. All right, dropping the link in one more time. There we go. I'm just gonna wait just a minute for folks to grab it because once I close the Zoom, it will be all gone. All right, all good?
Yeah. Thank you.
Bye, guys. Thanks
Bye.
again.
Bye.